This is a Dutch testing report tutorial. These tutorials are to be for educational information only and not intended to be medical advice. The results that are on the screen are generic and not from any particular patient results. There's a lot of data that we can look at here. The most important data that we want to look at with respect to cortisol typically is the free cortisol pattern. So we want to look at those 4 measurements from waking to early morning to afternoon and bedtime. Keep in mind that waking sample doesn't represent cortisol when you wake up. That's been collecting overnight, so it represents that overnight period of what the free cortisol pattern is. So we look at those 4 numbers and then we add them up, and that gives you this 24-hour free cortisol number, which in this particular case is below range, which tells you the cortisol is low overall in its free form. Now you're also going to want to look at when it happens to be lower and higher. Does it follow that up and down pattern that you're expecting to see, or does it have a dysfunctional diurnal pattern? So you want to look at the overall levels here, but also the pattern itself. Now that tells you the free cortisol, the systemic bioavailable active cortisol, but it isn't a very good marker really for the overall glandular output of cortisol, because the free cortisol is only about 1% of the total. It's an important fraction, but it's only a small percentage of the total. So metabolized cortisol is really your best marker for total glandular output of cortisol production. Now, in this particular case, the free cortisol happens to be low. However, the total glandular output is within the normal range. So that tells you that the cortisol production is a little bit more reasonable than the free cortisol would imply. So if it's on the lower side of normal, that's going to confirm that it's on the lower side, but maybe not as bad as the free cortisol would have you think. And if it's on the higher side of normal, then there's definitely appears to be decent cortisol output. So there's a few other things that we can look at here, but first just a word on cortisol itself. It's made by the adrenal gland as the adrenal gland gets signaling from the brain by way of ACTH, which is another hormone. So cortisol is made. Once it's made, it interconverts with cortisone in different compartments in the body. So certain compartments, like fat cells, like to turn the inactive cortisone into the active cortisol, whereas the kidney likes to turn the active cortisol into the inactive cortisone. So because there is this back and forth, we also want to look at the free cortisone pattern. It's of secondary importance, but it can help to confirm what's going on with the cortisol. So if the cortisol in this particular case is on the lower side, then we want to look at the cortisone as well to see if it's on the lower side as well, then that confirms that. If it's a bit higher, then maybe there's a little bit more than the free cortisol implies. There's another use for this that we'll get to in a minute, and that's to see if there's an actual imbalance in terms of a heavy deactivation to cortisone or in the other direction. But first, just a word about metabolism. So the free cortisol in its active form is going back and forth between active cortisol, inactive cortisone. And then they're both metabolized downstream to these cortisol and cortisone metabolites. So we call the total of that metabolized cortisol. And again, that's your best marker for total cortisol production. And so in this particular case, the free cortisol is a bit on the low side, whereas the production, the cortisol, the metabolized cortisol, it's not high, but it's higher, right? Which implies that maybe there's a little bit of increased cortisol metabolism, and the degree to which these metabolized cortisol are towards the elevated side would imply, how much there's an increase in terms of that cortisol clearance. Well, what causes increased cortisol clearance? Obesity, high thyroid, potentially long-term exposure to elevated levels of cortisol or cortisol-like medications can increase the body's capacity and ability to get rid of cortisol, which can cause this sort of a result where, again, the free cortisol is lower than the total cortisol overall. If you have opposite results in other situations where the free cortisol is higher, relatively speaking, compared to the total glandular output. So if the free cortisol is normal or elevated and that total cortisol production is low, then sometimes low thyroid can cause that. decreased liver function, as the liver's mainly responsible for getting rid of that cortisol and putting it into a form that can be excreted. So the other reason that we want to look at cortisol and cortisone, and this is of slightly lesser importance than the rest of the profile, but at times can really be enlightening, is we want to know, is there an imbalance here as we look at the activity of this enzyme 11-beta-HSD as it converts cortisol back and forth between its active and inactive form. So it's tempting to want to look up here at the free cortisol and cortisone to sort of tell that story. But what the literature, the scientific literature, would suggest is the best way to get an overall picture of that is to look at the metabolites. Because remember, free cortisol is about 1%. The metabolites are about 75%. They have a better representation of what's gone on throughout the day. So if there are more cortisol active metabolites, then that's going to point over in this direction. If there's more of a heavy deactivation overall, then it's going to point more in this direction towards cortisone. And you want to take all these things into consideration along with the clinical picture. We want to see the free cortisol over time, the total of production, and any metabolic preference that there might be. So I hope that's been helpful. If you have additional questions, please see DutchTest.com for other videos that can help you understand different components of the test. If you have questions, particularly from the patient perspective, please send those to your healthcare provider and work with your healthcare provider on those. And we thank you for testing with us.